Hi everyone, I'm Robin Smith, and my project that I'm planning is to improve patient satisfaction in two of the retail clinics that I currently work for. The intervention is called patient-centered care. The first retail clinic started in 2002. Since then, there's been a rapid increase of growth across the United States of this new type of clinic. They're staffed by nurse practitioners mainly and see patients who are age 2 and older for mild acute illnesses, vaccines, physicals, and prevention and screening of hypertension, diabetes, obesity, and tuberculosis. They're open 7 days a week and keep longer hours than a primary care office, usually open from 10 to 11 hours a day. Most are located in large discount stores, grocery chains, or drug stores. Some of the reasons for growth of retail clinics are the fact that the American healthcare industry has been unable to provide accessible, low-cost, and convenient care. Expenditures in the U.S. and healthcare surpassed $2 trillion in 2006, almost 3 times the $714 billion spent in 1990. Also, the U.S. has been having a widening gap between demand for primary care services and the supply of primary care physicians. There are 47 million people in the United States without health insurance. Those with insurance pay out more of their earnings in increased deductibles. Patient satisfaction in healthcare services is increasingly being used as a measure of health system performance. Some of the reasons for this interest is 1, the demand for public accountability for healthcare outcomes and the need to provide evidence of quality. 2, incentives of government funding are tied to equality. 3, patients have shifted from being passive recipients to making informed decisions of care. And 4, the managed competition approach to healthcare delivery in the U.S. And then lastly, the changed mix of healthcare workers in the acute settings. So in looking through the literature to try to find an intervention, I came across patient-centered care. And I found that patient-centered care focuses on the individuality of a patient. Some principles are that they are care based on healing relationships. Care is customized to patient's needs. The patient is the source of the control, and knowledge is shared. Decision making is evidence-based, and safety is a system priority. So this seemed to be a good intervention to study in the clinics that I work for. Patient-centered care, in looking at 5 random control articles, were reviewed, and all 5 showed an improvement in patient satisfaction. 3 showed improved communication, and all 5 showed PCC empowers patients to be able to make informed decision making. Baptist Express Care are retail clinics affiliated with Baptist Health. That's the clinics that I work in, one of them. There are 18 clinics located throughout the state of Kentucky. 2 of the clinics will be used in this study. There are 2 nurse practitioners and 2 patient access representatives in each clinic. And what a patient access representative is a receptionist, basically. I will be working with the manager and assistant managers, Christine Ewell and Michelle Sabarit, during the study. The intervention will involve collecting patient satisfaction surveys, pre- and post-implementation. Prior to starting the intervention, I will disseminate information by email to the nurse practitioners and the PARs, and obtain their consent to be involved with the study. I plan to spend 1 hour with each person in the 2 clinics providing an educational class which will detail PCC, or patient-centered care, and the intervention. In the intervention, I will give a list of activities for the PAR and the nurse practitioner, of which will enable the care they give patients to be patient-centered, such as asking about cultural concerns and having patients be more involved in their care. In measuring the improvement of patient satisfaction, the patient satisfaction surveys collected pre- and post-implementation will be used to conduct t-tests to test the differences. Does anyone have any questions?